Good evening, team. We are back. So, today we're going to be focusing on ear infections, specifically outer ear infections, also known as otitis externa. You'll also hear them called swimmer's ear. So, there is a number of reasons why you're going to have a sore ear, and there is a couple of different types of ear infection. But this video is going to focus, like I said, on the outer ear infection. So, what do I mean by the ear canal? The bit between the tympanic membrane, so the eardrum, and the outer part of the ear. So it's just that canal we're talking about. I think a whiteboard would probably be a grand idea, actually. Might get one of them. Let me know if you think it's a good idea to invest in a whiteboard. I can draw you some nice diagrams. Anyway, I digress. So, 90% of outer ear infections, otitis externas, are caused by a bacteria in that ear canal. And why do they overgrow? Well, it's warm, it's dark, it's moist in the ear, so it's a great place for them to breed and to populate inside your ear. So symptoms, what are we looking for? You don't have to have all of these symptoms, you might just have one, you might have all of them. So you might have a very, very itchy ear, you might have discharge coming from your ear. You might have also a sensation of fullness, so a reduced hearing in your ear as well. There could also be pain. The pain could be in the ear. You can feel it on your tragus or your pinna. That's the flappy bit here or the outer bit here, or it could be radiating into the jaw as well. So they're the symptoms that you're going to have. The signs that we look for is, again, tenderness on pressing this tragus and pressing the ear canal. We're going to have a look inside your ear, and that ear canal is going to look swollen, red. You might have a lot of debris or discharge in there as well. Sometimes that occludes the view of the tympanic membrane, so we might not be able to see the eardrum. If we can see it, the eardrum might be red. And also we might test your hearing, and so you might have conductive hearing loss as well. So overall, that's the signs and symptoms that we're going to be looking for. So you've just been diagnosed with otitis externa, swimmer's ear, your outer ear infection. So your treatment and management plan. Importantly, keep your ear nice and clean and dry for at least 10 days. So that's no swimming, try not to get any water in it when you're showering or bathing. Use earplugs, try not to get any soap or water or anything at all in it. You can even use a hairdryer as well to keep it nice and clean. You're going to be in a bit of pain, so you can use pain relief, ibuprofen, paracetamol. That should help manage the pain. So what are we going to prescribe? We're generally going to give a topical antibiotic, sometimes with and sometimes without a corticosteroid. So the antibiotic is obviously to fight off the bacteria that you've got in there, and the corticosteroid, so it's a steroid, is basically to reduce any inflammation that you've got in the ear. Might help a little bit with the itching as well. So normally we give something called Otimise, which has got a steroid on it, and it's got an antibacterial called neomycin. You're going to have to use that for at least a week. When you put it in, it's going to be the same as any other topical medication we give. So topical means localized to that bit of skin. So sometimes we give a topical antibiotic for a little infection on the top of your skin, and this time it's for your ear, obviously. So what we're going to do is you're going to put your head on a pillow on the side of the bed, spray it, wiggle your ear around a lot, make sure you get all the liquid in there, wait at least 3 to 5 minutes, and then you can put your head up, because if you do it while you're standing up, it will just dribble out and it won't work. So essentially we're going to be giving topical ear drops for your otitis externa. If there's treatment failure and it doesn't work, you'll come back and see us. We might swap it to a different type of topical medication. We might take a swab to see if it is bacteria, or which antibiotic will work best. See if it's fungal, because sometimes you can have fungal ear infections as well. Or sometimes we need to refer you to ENT to really clean out that ear. So they can give it an oral toilet, get rid of all that gunk in your ear if we really need to. Or they can do something called an earwick, where they put something in your ear and it basically lets you absorb all the medication up into that ear. So essentially, that is otitis externa in a nutshell. One thing you really need to look out for, very, very rare, you can get something called otitis externa, a malignant otitis externa. So basically a really severe infection in your ear, but you're going to have unrelenting pain, you're going to feel very unwell, you're going to be systemically unwell, so fevers, shivering, you're going to see redness spreading. So that's one thing to look out for. And if that does happen, seek medical attention as soon as you can. Well, thank you very much for watching, team. Any questions, do ask. Again, if you want me to make a video about anything else, please drop it in the comments.